COVID may not be top of mind for a lot of people right now, but unfortunately cases are rising again. And with kids going back to school, there are more problems, the concern about spread. We've got infectious disease expert Dr. Amesha Adalja joining us live to talk about where we go from here. Dr. Adalja, good to see you. Tell us what we need to know.
Well, what we know is that COVID-19 is an endemic respiratory virus. It's not something that's going to go away. And as people congregate, you're going to see cases. But thankfully, because of the immunity that's in the population from vaccines, from boosters, from combinations of those, we don't necessarily see the same alarm with it. But it is something that we expect to see along with other respiratory viruses as children go back to school. That's going to be the norm.
All right, so let's get this straight. We are seeing a rise, but we do not need to panic and go grab masks and start distance learning and grabbing all of the toilet paper off of the shelves again. Correct, Doc?
Correct. When you look at the tools that we've developed over the last 3 years, COVID-19 has become much, much more manageable. But it is true that if you're high risk, if you're somebody that's older, obese, pregnant, has some high risk condition, immunocompromised, you might want to wear a mask in a crowded, congregated area that's indoors. But for the vast majority of people, this is a manageable illness and not the same level of alarm that we've seen. We're not seeing hospitals in crisis, even though hospitalizations have gone up. We've come a long way, and I think that's really a testament to all the work that science and medicine have done over the past 3 years.
Sure. Dr. Adalja, anything you're keeping an eye on as we're seeing these case numbers rise yet again?
I'm keeping an eye on the variants just to see, because in the fall, we're going to have a new COVID-19 booster that's going to be released, and some of those variants may pose problems even for the updated version. So I'm tracking those variants to see if that's going to pose a problem. But even if it does, it's more of a problem in terms of infections, not so much in terms of severe disease. I'm also looking to see, do we get more data on antivirals and their ability to prevent long COVID in that small proportion of people who get long COVID? So there is still a lot of scientific questions that are going to be addressed over the next couple of years, and those are going to have important. Those are going to be important for how we manage this going forward. But it is with us to stay, and I think we have to keep that in mind every time we hear about some uptick that occurs.
Got you. Thank you much.
Dr. Adalja, good to see you as always. Thank you for keeping us updated.
Appreciate that.